Hello, my name is Travis Wolf, and I'm going to tell you two stories about cardiac arrest and the difference early CPR can make. First, I want to give you some background about myself. I've been serving in the emergency medical field for 8 years, where I work on one of the busiest ambulances in the state of Alaska. Medic 1 is the primary advanced life support ambulance for the capital city. This ambulance and its personnel treats and transports thousands of patients every year, some suffering from minor injuries, others hanging on by just a thread. The most serious cases involve patients suffering from cardiac arrest. Cardiac arrest goes by many names: myocardial infarction, flatline, code blue, or heart attack. But they all mean the same thing: your heart isn't working. Now, this is due to a variety of heart complications. However, many of these problems cannot be solved without surgical or pharmacological intervention. Therefore, as a pre-hospital provider, it is my job to maintain adequate perfusion. In essence, we become the heart. By performing cardiopulmonary resuscitation, or CPR, we manually pump blood around the body. CPR combined with some pharmacological magic and 300 joules of electricity might make the difference between life and death. CPR is a simple skill to learn. All healthcare providers are required to attend a CPR class before their first day on the job. A doctor, nurse, EMT, or paramedic typically teaches the class, and is based on a standard curriculum outlined by the American Heart Association's Cardiac Arrest Survival Research. This 8-hour course is comprehensive and only requires continuing education training every other year. So what does this mean for you? CPR isn't just a skill for first responders, doctors, and nurses anymore. Effective CPR must be delivered early by anyone. And let me explain why. My first story takes place on a typical Juneau day. At approximately 5 a.m. we received a report of a man found unresponsive by his wife. We raced from our beds to the apparatus floor and began to drive to scene. A typical response time in Juneau is about 5 minutes from report to arrival. CPR was started immediately upon arrival. CPR for us is like reading a script. There is an order everything happens. First, we assess the patient and determine whether this was a witnessed or unwitnessed arrest. The difference determines whether we shock the patient right away or perform compressions. The patient had not received CPR prior to our arrival, and therefore we had to start from scratch. We started compressions, hooked the patient up to the defibrillator, placed an endotracheal tube down the patient's airway, and started an intravenous line for medication. CPR is performed in 2-minute intervals so we can reassess the patient and determine if a different course of treatment is necessary. CPR was performed for 15 minutes before a return of spontaneous circulation was found. This means the patient's heart began beating on its own. Once we achieve this, we can start to package and transport the patient to the hospital. The patient arrived to the emergency room within 30 minutes of being found. He was later medevaced to Seattle's Harborview Hospital, where he was pronounced brain dead and removed from life support 3 days later. Our crew performed CPR flawlessly, and every treatment was performed to help save this patient. Because there was a delay in performing CPR, this patient died as a result. My next story has got a different outcome, and see if you can tell why. While attending a high school basketball game, an elderly gentleman collapsed in front of a dozen witnesses. CPR was started immediately, and EMS was called. We arrived within minutes of the report and began to work. Because adequate CPR was being performed prior to our arrival, we were able to shock the patient immediately and gain a return of spontaneous circulation. We performed all the same interventions as before, with one detail changed. The patient received early CPR. 2 months later, after several surgeries and a lengthy hospital stay, this patient walked through the doors of the fire station and shook my hand. At the time, I couldn't help but marvel at this person's recovery. But it wasn't the efforts of first responders that saved this person's life. It was the quick response by bystanders that did. Early CPR saves lives, and this man is a testament to these actions. In Seattle, a place known for the highest cardiac arrest save rate, this story is all too common. Seattle has seen a remarkable change in survival outcomes by adopting several practices. First, they have trained their responders in the art of high performance CPR. This change from the previous model emphasizes hands-only CPR, push hard, push fast. Additionally, they have also brought CPR into the workplace and schools, Every high school student will receive a CPR card along with their diploma, and every workplace has CPR taught to their employees. This shift in who can perform CPR has caused Seattle to double the national average in cardiac arrest saves. Seattle is the safest place to live if you are going to have a heart attack, because everyone knows how to help. My point is simple. Teach early, start early, CPR saves lives. Using the Seattle model for high-performance CPR in addition to teaching the curriculum to high school-age children, eventually everyone will have the necessary tools to save a life. An 8-hour class and 2 hands. Thanks, and be safe out there.